Hi and welcome. Thank you. Um, as we, I think, all know, something like 700,000 U.S. citizens have come down with coronavirus, and something like 30,000 people have died from the virus. And one of the things President Trump has done has ordered a halt to the funding for the World Health Organization and an investigation into how they could have misled the world or the U.S. so badly and let this happen. And I believe that is completely a false narrative. The World Health Organization was imperfect. They were slow in some areas, but the response in the United States was a mess and has killed many more people than it should have, largely because of President Trump's unwillingness to acknowledge the seriousness of this and to listen to the experts. So as I often do with my videos, I start with my dashboard from Johns Hopkins. So 671,000 U.S. cases right now, and the deaths for the U.S. are not listed by the country, they're listed by state or area. So New York City alone has 11,000 deaths. So compared to every other country in the world, Italy, Spain, France, and the United Kingdom have more deaths than New York City. New York City has more deaths than Iran and South Korea and country after country, more than China. Okay, so one of the images we saw a couple days ago was mass graves being dug in New York City for people, I believe, that didn't have next of kin or any plans that how they're going to be buried, which is really quite sad. And the whole point of this is it's a very bad situation in the United States, and large parts of it were preventable. And I'm not just saying that in hindsight. There's lots of evidence that, yeah, people knew. I'll just stop. Okay, so let's look at his record. So this is actually something that the Independent put together. I believe it's a newspaper in Britain. And it's an interesting way of looking at the data. Time is on the x-axis, and then the number of cases in the U.S. is on the y-axis, and select Donald Trump quotes are in these little different colored things. So I blew up this light green and dark green one. So this is now end of February, February 28th, March 1st, when these happened. One day it's like a miracle, it will disappear. So we already had cases in the States, and he's arguing it's nothing to worry about, they'll disappear. At his campaign rally in the end of February, he actually said that this is a Democratic hoax, and that the CDC had also exaggerated the dangers of this to try to hurt him in his reelection bid. 4 or 5 days later, he said, I think we're doing a really good job in this country at keeping it down. Something like March 11th, he said, it'll go away, just stay calm, don't worry. And within several days, he had declared a state of emergency. And once he declared the state of emergency, he then said, I've always known this is a real pandemic. This is real, I've always known that. Despite the fact that for the better part of a month and a half, he had been telling people to stay calm, it will go away. So either he didn't know, or he lied. Because if he knew all the time that a pandemic was happening, why would he tell us everything's fine and it's going away, right? It doesn't make any sense. So this is a timeline I put together of this, and it includes some information about what his activities were during this time, including political rallies in R and golfing retreats in G. To just look at how he's dividing his time amongst some of his election-based activities, his leisure-based activities, and his attention to potential affairs that affect the states. So starting on the left, China first identified this as a coronavirus on the 7th of January. They sequenced it on the 12th of January and made those sequences available to other countries so they could be building their own diagnostic kits, 12th of January. The 21st of January, the first situation report comes out from the World Health Organization, and they said at that point there's 282 cases. So this is an important part of that report where they talk about the cases. The World Health Organization informed other countries about the situation and would provide support as necessary. So they were already communicating with other countries, presumably that includes us in these states. At the end of January, on the 31st, this is now just 10 days later, we've gone from a few hundred cases to 10,000 cases. And we've gone from 4 countries, which was really China plus 1 or 2 cases in South Korea and in Thailand and I want to say Japan. Anyway, it's in 14 countries at that point. The World Health Organization declared a public health emergency of international importance, and they ranked the risk to the globe in terms of this as a public health emergency as high. They have one category higher that's called very high. It's not low, it's not moderate, it's high. And that's January the 31st. Okay, so this is that information. Here's the specifics of the numbers, and they had already clearly identified it as a very high risk in China because it was already a problem that was very significant there, but they had said at the global level it's high. Okay, let's see, 20th of February. Now this is one of the most important pieces of evidence that we had that we should be very, very worried. This is a graph showing where the likely exposure occurred for cases that were diagnosed. So these early cases in early January were all associated with being in China or interacting with someone who had just come from Wuhan, so that the source of the infection was in fact China. These green bars are the parts where the source of the infection actually came in the reporting country. So if it was reported in Italy, then that person acquired it in Italy. And the green bars are now far larger than the orange bars by around the 1st of February. So starting around the 1st of February, moving forward beyond that, most of the cases outside of China were not directly associated with Chinese travelers coming to source countries, but people that were already there that had been exposed, spreading it to other people, the secondary infections. Which is why the travel ban from China at that point was unlikely to be of any use at all, because it had already spread to dozens of countries. So moving along to the 26th now. Trump dismissed complaints from Democrats that he was not taking this seriously enough. He said this is their new hoax and we are totally prepared. So this is 6 days after the world hit 75,000 cases. This is 6 days after the U.S. had its first 15 cases. This is 6 days after most new infections were shown to be acquired in their host country, not in China. I just whacked something. Sorry about that. So this is one of the news covering his February 26th press rally, actually. And he is patting himself on the back. We've done a great job. And he was asked very specifically about supporters like Rush Limbaugh, who have advanced the idea that the Centers for Disease Control and Prevention had exaggerated the impact of the coronavirus to hurt Trump. And Trump's opponents, the Democrats presumably, had weaponized those estimates to hurt him further. So there's 2 parts to that. The CDC is lying, and the Democrats are using that to hurt Trump. Trump says, I agree with it, and I'd like it to stop. He agrees with this statement that the estimates are over-exaggerated and they're being used to hurt him politically, showing absolutely no comprehension of the nature of the threat. And doing a tremendous disservice to Americans by not acting. Yes, this is the same thing, their new hoax. Okay, 28th. So 2 days after he calls it a hoax and we're prepared, the U.S. now has 60 cases. We had 15 cases a week before. So we've quadrupled in a week. Quadrupled in a week. That's doubling time of every 3.5 days, which we know is anyway. And the World Health Organization raised their estimate of the risk to the globe to very high. Now, when there were 24 countries infected several weeks before, or maybe even 15 countries several weeks before, some of those countries being in Europe, we probably should have said, yeah, it's actually a global problem, not just a Chinese or a regional problem. So that was slower than it should have been. But they were putting out really good information about where the cases were, where they were being acquired, what the epidemiology was. All of that was coming out. There were daily reports every day from the 21st on. Okay. So they, as I said, changed the global risk to very high, and they reported that two things. They said the U.S. has 59 cases and evidence of local transmission. So that's not 59 imported cases from other places where people had been exposed, or people came in with the disease and their spouse got it. This was local transmission. Let's see. On March 11th was when the virus had spread to 109 countries. There's a little thing up here about Dr. Fauci actually talking about community spread on Fox and Friends on the 1st of March. I trimmed it out to save time. I also trimmed out some more things about the situation report on the 5th. But in any case, the pandemic was declared on the 11th of March. And again, I think the pandemic was obvious when we were somewhere in mid-February with dozens of countries involved and local spread in many of them. That's when the pandemic really should have been called. And so they were a few weeks late. But that information, the fact that they didn't call it, doesn't mean that any other country couldn't have looked at the data and said, oh, we should start preparing. And in fact, in the World Health Organization documents, even when they said it wasn't a pandemic, they said you should be preparing to test and identify cases and train healthcare workers and so forth. So they were saying, prepare. Okay, so there was an interesting piece on NPR just a couple days ago that was referring to the national emergency that was declared by Trump on the 13th of March. And this is a picture of that declaration. And there's two things by it. It was flanked by leaders from giant retailers and medical testing companies and drugstores and so forth. And he promised us a huge public-private resource mobilization, which has not really happened. But he also said, we've been working very hard. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. None of those things are true. We had faulty testing, and that's about it. So this is actually the day after as well, another press conference. And both, he tweeted out, I think on the 14th of March, about social distancing and staying away from people and you know, helping slow the spread. And yet he's having an indoor press conference with people packed in around him to make a good image for TV. And of course, on March 22nd, a few days later, Trump said, I wish they had told us sooner, 3 months or more sooner. This is referring to the Chinese. We didn't know about it, he said. Well, there's two problems with that. One is the disease didn't exist 3 months before. It was first identified 2.5 months before, and the genetics were first identified about 2 months before. So it shows a complete lack of understanding that this is a emerging zoonotic disease that had just entered humans for the very first time. That's why they called it the novel coronavirus. And we didn't know about it. There at that point had been 60 daily World Health Organization reports detailing very much information about number of cases in countries, how many countries it had spread to, evidence of local transmission. They had called it a pandemic. There were thousands of deaths and many deaths in the U.S. At that point. This was well after the U.S. had passed 1,000 cases and 25 deaths. And now he's complaining that there was no way we could have known about it, which is simply not true. So the World Health Organization bears some responsibility for acting slowly and trying to balance concerns about economic disruption and social disruption with the potential real concern about the health emergency. That was a problem in January. So when Italy and Iran got their cases and the infections really started to take off, they didn't have nearly as much information ahead of time as we did. we actually not only got to see what happened in China, but we got to see the first major flare-ups outside of China in Iran and in Italy long before we had large numbers in the States, and it was growing quickly, and we ignored that as well. And so that's on our president. He had a hunch it wasn't going to be a problem. He had a hunch the warm weather was going to make it go away, that it was going to turn out to be nothing more than a flu-y-like thing, maybe not as bad as flu. Those are all things he said, and all of them were wrong, and all of them were in complete contradiction to the facts that were known at that time.